Coming home, one, I would say to anyone who's watching this, if you don't have someone at home with you, absolutely bring in a friend or a cousin or something. There's no way they could send me home alone.
Being the patient, being looked after at home was not an easy thing. I'm not accustomed to that.
I would say to somebody to not go into surgery until you know you've got everybody routed, that you know you've got your people, you have your team, and that can be one person, a spouse and a child, but you cannot be alone, no way.
If you need additional equipment, that's our responsibility to make sure you have that equipment when you get home, whether it be a walker or whether it be a raised toilet seat, or what I call reacher grabber, so you don't have to bend over all the time. And those kind of things, again, may be an asset to you as far as your recovery goes.
You drop a bar of soap in the shower, you gotta scream for somebody to come get it for you, because even with your grabbers, you can't pick up the soap. So it's humbling. It's very humbling.
And I just kept thinking that I'm gonna get up the next morning and I'm gonna start to recover. Kind of like when you have a really bad flu, all you can do is lay in bed. And weeks went on and I wasn't getting my energy back. I got a little worried.
I like to tell patients, if you had a flu, you just felt cruddy, you felt weak, you didn't feel good, you're gonna go home and you're gonna drink fluids, you're gonna lie in bed, you're gonna watch TV. If you feel good enough, you're gonna walk outside. And for the first week, maybe 2 weeks after surgery, that's what I encourage patients to do.
You're managing your pain as best you can, trying to follow the directions that the doctors have given you. They remind you to not do any of what they call the BLTs, no bending, lifting, or twisting, which is pretty good advice.
Being a patient at home, I always find more difficult because there's things I can do, or I think I can do. I wasn't supposed to pick up anything heavier than a coffee cup for 6 months.
You've got people all around you who are trying to help, but you're really in it alone. My kids would come get me at the hospital. You're in a big back brace. It's hard to even get into the car. You go home, you try to get comfortable in bed. You're completely out of it, no appetite.
The healing period and the nerve pain was very, very long.
You're in this alternative space where it's pain and discomfort.
Happy to get out of the hospital. The first month of being home was the worst month of my life. My orthopedic surgeon told me, he warned me, you're gonna be tired.
If there are new symptoms that you did not have prior to surgery, that's something we would not expect, and that's something we want to hear about immediately. There's nothing, unfortunately, really that you can do as a patient to make your recovery faster, to make your bones fuse more quickly. Your body will really do what it has to do, which is recover.
I was just totally drained, wiped out. I couldn't get up to even get water from the refrigerator.
There's a lot of things that you can do to make it worse. There's very little really that you can do to make it better.
The doctor told me to do as little as possible for a month. I couldn't do much at all. And with my 3 kids, they'd say, will you do this? And I'd say, no, you guys gotta do it. You gotta pick it up. And I remember the water bottle needed to be changed. And I was like, well, whatever. It's not gonna happen with me.
I'm in great shape. My resting heart rate is like 35. I'm gonna be fine in a week. Sure.